Hello, my name is Dr. Brandon Pettke with Lone Star Progressive Medicine. Welcome to this video. Obviously, if you're watching this video, you've shown some interest in weight loss or genetic weight loss program that we do here in the clinic. And so I want to share some of the information about our program and what we do here and what makes us different and why we've had such tremendous success with patients. So anyway, I want to go into that. And then at the end, if you want to set up a consult to meet with us, we'll go ahead and discuss how you can do that. But let's just jump right into things because that's what you're interested in. As I always cover this with patients and what we do different, there's two main things that I would say that our program is number one, it's an all-natural program, and number two, we use genetic testing, and we do that so we're not just doing a same cookie cutter approach for every single patient that comes through the office. And so I'm going to touch a little bit more on that here in a second. But I first want to go over the all-natural part of the program. So what I mean by all-natural part of the program is we don't do any weight loss medications. We don't do injections. We don't even do B12 injections. We don't do any prepackaged meals. We don't do protein shakes and protein bars and protein shakes. We don't do any of that stuff. What we use with our patients is just all regular food that you can find at any grocery store. So it doesn't matter where you go. You can shop at Walmart, you can shop at H-E-B, Albertsons, Kroger, wherever. It doesn't matter. What I mean by that is you don't have to go to like a specially like health food store. You don't have to go to Whole Foods or something like that. The food can be found anywhere. All right. So what we do is we take patients through a process. There's kind of two major phases. There's an initial 6-week phase. And then depending on what the patient needs to accomplish in terms of weight loss goals, the next phase can last just from a couple more months to up to a full 12-month time frame that we work with a patient. So obviously we have patients that only need to lose 10 or 12, 10, 15 pounds, something like that. And then we have those patients that have lost over or need to lose over 100 pounds. So we got a whole gamut of patients. From teenagers up to people in their 80s. So we've treated a ton of patients, even patients that have had gastric bypass and gastric lap band and gastric sleeve and even the balloon. We've had patients that have done all of that stuff, and we've still been able to help them. So let me kind of jump into the program. There's two major phases to the program. Like I said, there's an initial 6-week phase that we take everybody through, and then depending on how long we're working with a patient, that'll determine the length amount of time for the DNA phase. So the initial 6-week phase, there's two main things that we're trying to accomplish during that phase of the treatment. Number one is as the patient, you want to have quick results. So we understand that, and we want you to have quick results. So we're gonna get you a significant amount of weight loss in a relatively short amount of time. Our average during the initial 6 weeks is 22.4 pounds. That's the average that our patient loses during the initial 6 weeks. Now, obviously, if you only have 10 to 15 pounds, you're not going to lose that amount, right? So, but if you have a maybe say 50 pounds or something like that to lose, maybe even 35 pounds, something like that. You could lose a good chunk of that average within that first 6 weeks. So it's quite a bit, and you'll definitely feel better about yourself. People are going to definitely notice a difference and change, and you're just going to feel better overall. So anyway, so that's number one goal. Number two goal, really the more important part, is when people come to us for weight loss. You basically have two fuels that you can burn. All right, you can burn glucose, which is essentially sugar, or you can burn fat for fuel. Okay, and so when people are having difficulty losing weight, they're over here. They're primary glucose or sugar burner. And so what we got to do is we got to take them through a process where they become a primary fat burner, and they're using fat for their fuel. And so for most patients, that takes about 4 to 6 weeks, which is exactly why we have this part of the program laid out for 6 weeks. And so what we do is we focus on two things with the foods. The foods have to be anti-inflammatory and also low glycemic. Okay, so what that means and the importance of that. There's so many patients that we see that an underlying cause of a lot of their issues and symptoms that they're experiencing is inflammation. I'd probably say 80-ish% of our patients that come in for weight loss have some type of GI, your gut dysfunction. So common symptoms of that would be discomfort or pain after they eat. They have like gas, bloating type sensation. They may have issues with constipation, diarrhea. I know, all fun stuff to talk about, right? But anyway, these are legitimate issues. If you're experiencing it, you know it's no fun. They may have been diagnosed with IBS, gastritis, things of that nature. So they get some GI stuff, and that not only affects metabolism and the ability to lose or not to lose weight, I should say. It's also going to affect a whole other host of issues in the body that may seem unrelated. So we'll touch on that if you end up doing a consult with us and tie all that together. But anyway, we got to focus on those foods that are anti-inflammatory. And then the other thing that we have to focus on are foods that are low glycemic. And so what that means is that foods that don't raise or spike blood sugar, which raise or spike insulin. All right. There's about 26 known hormones in the body. I won't bore you with them all, but insulin is probably the most, the biggest one that affects weight loss. And what happens is it creates this whole physiological effect that doesn't allow the patients to lose weight. And I'm going to touch on this because this is a big, big thing. All right. I know for decades, people have been pounded in their head that weight loss, if you just eat less calories and you just burn more calories, you'll lose weight. Well, unfortunately, that's not really how it works. All right. And if you're watching this, you may have already tried that, and you've known that you've pounded away at the gym. We've had many patients that have, I've been so diligent working out the gym for 6 months, a year, and I've barely lost anything. Okay, well, this is why. Weight loss is primarily hormonally driven. All right, 80 to 90% of the equation for the weight loss equation is hormonally driven. 10, maybe 20% is calorie driven. All right, so what we got to do is we got to figure out for the individual is we got to figure out not only how their body responds to these different foods, but then we tap into the genetics and we can really do that. So anyway, I'm not going to bore you anymore with that. I just want to keep this short and sweet. But we're gonna make it really easy for you. We just give you a list of foods that meet that criteria, and you go to the store and you buy what you like off of that list. It's nothing crazy. It's proteins, it's vegetables, it's fruits, it's healthy fats. I mean, it's nothing abnormal. If you're a vegetarian or vegan, we can modify the program and we can take care of you too. We've had a number of vegetarians and vegans go through the program as well. So anyway, so if that's you, we can adapt the program to you as well. So that's what we focus on there in the foods during the initial 6 weeks. We also have some key supplementation. There's actually 5 things that we have patients take. One is a multivitamin, multimineral. The second one is a therapeutic grade probiotic. Then we have patients take a B12. So that's going to help with energy levels. It's also going to help your liver detox. We'll do a detox formula, and then we do a weight management formula. All these are all natural formulas. We don't have, like any stimulants or anything like that in them, so they're safe for people to take. So anyway, we do that initial 6 weeks. You'll have a significant amount of weight loss, and then we'll start transitioning into the DNA phase. And so on the DNA phase, what we do there is the testing. We do that at the beginning. We get that sent off to the lab. It's super easy. Just a swab on the inside of the cheek. You put that in, and we send it off to the lab. And then by the time we end up that 6 weeks, we start transitioning into the DNA phase. And so that DNA report, we get that back from the lab. It's like a 50-something page report. It's pretty in-depth. It's going to go into everything for you based off of your specific genetics. And it's going to outline everything for us. So it's going to tell us, what percentage of your calories should come from carbs, what percentage should come from proteins, what percentage should come from fats. And then it's going to break that down. And what I like to say is it puts it into real world usable information. And so it's going to tell us, based off your activity levels, it's going to tell us how much servings of protein you should have, how many servings of vegetables, of starches, of fruit, of dairy, of fats, all that type of stuff. It's going to break all of that down for us, and you and I will go through that. We'll cover that that DNA report. But it's also going to go over your exercise. So it's going to tell us, based off of your genetics, here's the types of exercises that you should do to optimize your metabolism. So it'll cover that as well. And we'll take that information, and then depending on what you specifically need, we'll utilize that information for the remainder of the time that we're working with you as a patient to help you reach your goals. So anyway, that's kind of an overview of the program of what we do here in the clinic. If you want to come in and you want to, and we also have telemedicine available. If you want to come in physically into the office, you just give our office a call, and we can set that up, or email us. There's multiple different ways to do that. If you want to look at our website and some of the success that we had, the website is fatlossburleson.com, fatlossburleson.com. And if you click on that, there's a little tab there for testimonials and success stories. We got a plethora of people that have shared their story with us if you want to do that. But if you want to set up a telemedicine consult, you will click the link to request that appointment, and office will be in contact with you, and we will get that set up and get you taken care of, and we'll meet with you, and we'll go from there and let you know. We do have the program is not covered by insurance, so no insurance is covered, so it's just an out-of-pocket program. We do have patient financing if patients need it. Most of our patients, usually their programs run somewhere between $113, $150 a month or something like that. So we still try to make it as affordable as possible, so patients can not only lose the weight, feel better about themselves, but really have a much higher quality of life and higher quality of health. So anyway, we have all that stuff available for you. So if you want to make an appointment, just click on that link, fill out that information, and I look forward to meeting you and helping you out in any way I can. Have a wonderful day. Take care.